Well, thank you all for your patience and for joining this webinar. And we are going to talk today about the emerging Zika virus and give you an update on what's going on. I'm Wendy Green. I'm the director of iJET University. And during this webinar, you will hear about how the Zika virus has emerged into a worldwide threat and what countries are doing to address it. We'll also learn about what you can do to avoid becoming affected with the Zika virus. The webinar will be recorded and it will be available on the iJET website by the end of the week. There's a survey that pops up at the end of the webinar. There are only 4 questions in the survey, and we really do use your answers to improve what we offer, to provide you the kind of information that you want. So please take just a minute to complete that. It is now my pleasure to introduce you to our presenters, Catherine Harmon and Chris Pardee. Catherine is the Director of Health Intelligence at iJET International, where she leads a team of analysts in collecting, analyzing, and disseminating information on infectious disease threats and chemical, biological, radiation, and nuclear issues occurring globally to a vast traveler and client base. Additionally, her team manages multiple projects and areas of focus as subject matter experts in health intelligence, as well as publishing the weekly Health Intelligence Monitor for the subscribers. Catherine came to iJET several years ago after practicing occupational medicine and health, both in private practice and for a leading contractor for the Department of Energy. Her diverse background provided oversight of multiple programs, including the medical and behavioral health component of the Human Reliability Program for nuclear workers, assisting in mass casualty events, maintaining a variety of surveillance programs, and OSHA care and compliance. She has also consulted as an SME in chemical and biological security matters, having been trained in computer modeling and simulation, as well as analytical tools for red teaming techniques and vulnerability assessments. Chris Pardee joined iJET in July 2009 after earning his Master's of Science in Biohazardous Threat Agents and Emerging Infectious Diseases from Georgetown University, where he studied emerging and re-emerging pathogens, as well as pathogens and dual-use technologies with the potential for use by bioterrorists. He previously studied microbiology, history, and criminology at Ohio State University. In both academic and professional environments, Chris has used open source intelligence to track and assess global infectious disease outbreaks and relate these bioevents to social and economic disruptions. Chris's writings on the impact of international diseases have also been featured in other travel and healthcare-related publications. So 2 great presenters. Catherine, please get us started.
Thank you, Wendy. I appreciate that great introduction. Thank you all for joining us today. What we'd like to do is give you information on Zika virus. As you all know, it's been in the headlines in multimedia for the past several weeks as this new virus has emerged into the Americas and has started to spread throughout multiple countries for both local endemic cases being passed within the countries themselves, as well as reported imported cases from travelers who have visited these nations and then tested positive when they return home from their international travel. Zika virus, we're hoping to give you some information on it that hasn't been shared in the news because of their limited capacity in time with interviewers, as well as their editorial constraints with information and the space allocation that they're given. So in filling in some of these gaps and information, you will be better equipped to understand the exact threat of this virus. We've been following it for several years into its emergence into Polynesia and now into the Americas. So Zika virus has been around since the late 40s. It was discovered in Uganda near the Zika River, originally in primates in 1947, and then in the early 50s in humans. It is a mosquito-borne virus like many other diseases, malaria, yellow fever, West Nile virus. And what's important to understand is that mosquito-borne viruses can only be carried by certain species of mosquitoes, and they're usually independent. So West Nile virus, is carried by one species of mosquitoes, but cannot be carried by some other species of mosquitoes. So the kind of mosquitoes that carry malaria, also do not carry dengue, chikungunya, or Zika virus. And what makes that very important is the ones that carry Zika virus, the Aedes aegypti and the Aedes albopictus, have a certain range. So they need a specific kind of climate, and they need a specific pH of water. It can't be too acidic or alkaline. They also need a specific temperature in order for them to live and thrive. What is kind of bad about this is that they're very adaptive, and they can have a very wide range globally. They've learned to evolve, and they've learned to thrive in many different environments. These are aggressive day-biting insects. So the malaria-carrying mosquitoes are night biters, but these are day biters. So they like to live in urban environments rather than in rural environments. So instead of liking the jungle, they really like the cities, and they like to lay eggs in trash and in streets, in puddles, and they just thrive in salt marshes and in many different kinds of areas. So as I said, they have a wide global range. They're resistant to weather patterns. So they can live during droughts. What they do is they bury themselves in mud when it has a little bit of rain, and their eggs can live up to 5 years before they hatch. They are very environmentally sound and hardy insects. And they do what's called overwintering. So like if there are any gardeners in the audience, when you plant a bulb, you plant it in the fall before the first frost, and then you let that bulb overwinter, and then when the spring comes and the bulb knows that the earth is starting to warm up and it's starting to get wet, then it sprouts and it becomes a daffodil in the spring. The same thing happens to mosquito eggs. The mosquito will lay its eggs when the fall comes, and then the eggs will go into hibernation. They will go into a state of dormancy, and they will overwinter, and then when the spring and the summer comes, then they will hatch when the weather becomes warmer and when it becomes wet, and then they will become the larvae and then become adult mosquitoes and thriving. The mosquitoes move by international travel and trade through people and cargo. So one of the ways that these species of mosquitoes have come over to the Americas is through cargo from Asia, Polynesia, and Africa. They hitch rides, and often people who are moving from place to place, they may pack some of the eggs inadvertently in their suitcases and even bring them home with them. Or people who travel, and the reason they're watching these imported cases so closely, like the ones that have shown up in the United States recently, is because we have these mosquito vectors here in the U.S., and the mosquito species, and so if we have enough travelers returning with the virus, then all they need to do is be bitten by one of these uninfected mosquitoes, and then we can have this virus here in the United States. So agencies like the Center for Disease Control, Health and Human Services, and now the Department of Defense are watching all of these areas that have these mosquito vectors very closely. So we don't get a health threat in a new place. All right. So in the progression of spread, as I mentioned, it first started in Africa, and then it was seen in Southeast Asia, and then it moved from Southeast Asia into Polynesia, where there were notable outbreaks in 2007, and then reemerged in 2013 and 2014 in French Polynesia and Yap, in Micronesia, and several other islands, and then was noted in Brazil in 2014, quickly took a foothold in Brazil, and then moved throughout the Americas during 2014 and 2015, and then moved up through Latin America, where we're seeing the current outbreak into Mexico, Puerto Rico, and the Caribbean. Because of its rapid detection and spread throughout the Americas, everybody is now taking notice of this virus, and like its cousins with dengue and chikungunya, there is great concern that we have a new global emerging health threat. Okay. So why Zika and why now? Why did it take so long for Zika to appear in so many countries? As I first mentioned, it was discovered in 1947, and it's not spread from person to person as we think. It's just spread from mosquitoes to people, and it takes some international travel and international trade, and we see this balloon effect. And one of the reasons that we think that it has taken so long is just its discovery and testing. Because Zika is so close in symptoms and similarity to dengue virus and chikungunya, a lot of authorities think that it just wasn't tested for, and it was mistaken for one of the other viruses. The difference between Zika and other mosquito diseases is very difficult to make. There are so many similarities between the two, making the initial diagnosis is very difficult. And in many of the countries where these diseases occur, there are not many good resources to be able to test between. When a patient appears with a rash and a fever and joint pain, it was just an initial assumption that they had a dengue virus, and blood was not drawn to test and distinguish between the three of them, especially when there's not good treatment for anything. It is not, none of these are curable diseases. Now that Zika has been linked potentially to birth defects, microcephaly, we've heard a lot about in the news, and other neurological problems, a condition called Guillain-Barré, which is a neurological issue of ascending paralysis, it's more important than ever to make the determination between these three diseases. Dengue is a virus, also mosquito-borne, that may cause hemorrhage with repeated infections between the different strains. Chikungunya can cause long-lasting pain and issues with arthritis. Delays in reporting about Zika virus and underreporting is what has probably caused the issue of being so long for us to hear about this virus. So on this chart, you can see that most all of these three viruses, dengue, Zika virus, and chikungunya, which are all mosquito-borne, and all in a similar range of countries and areas. All of them have fever. They all can appear with rash. Patients present with muscle pain. Many have joint pain. Very rare do dengue or chikungunya have the eye redness known as conjunctivitis. That's like pink eye. When patients do present with red eyes, That's usually with Zika virus. Most of these all have headaches, and rarely do dengue and chikungunya have neurological issues. But certainly the goal is to discover that patients have Zika virus before any kind of neurological problems set in. Okay, so this is kind of a busy slide, but you can see right now that many countries are affected by dengue and chikungunya more than Zika virus. Zika is in purple down in the lower left-hand corner. These are maps from the World Health Organization and for the Centers for Disease Control. Chikungunya is in green. That's not to say that everything in green, like in Alaska and the United States, the chikungunya is running rampant all over the country. That's just to say that a case has been reported, at least one time. And then in dengue up on top, we know that there are many cases that being reported in the tropics and subtropical regions globally. And it is an extensive issue. All right, so in cases from 2014 and 2015, Colombia has been very hard hit with Zika virus. Initially, Brazil has not reported on the number of cases of Zika virus it has. There's very poor data that has come out of that country. They suspect that there are over 1 million cases of Zika virus throughout the entire country of Brazil, but they do not have a total number of case counts. Colombia has much better reporting. As you can see, the cases per 100,000 people has risen exponentially since the beginning of 2015. Dengue fever in Colombia in 2015 has pretty much stabilized. We put that in there so that you can see per week. It rises and falls with the rainy season, but when dengue fever came to Colombia, it came there to stay. There's very poor mosquito control in the country, and once this virus had a chance to establish its presence, it just became there, an endemic disease, which means that there's local transmission, it's going to be there, and it's going to stay there. And the fear with Zika virus is the same thing is going to happen, and if there are positive links between neurological disease and genetic defects with infants and dangers to pregnant or childbearing women, where they can prove a linkage between this virus, and these dangers, then this is going to be a very big threat to the population, to expats, to nationals that live in this area, because the mosquito control just isn't going to be efficient and effective. Okay, in comparison to chikungunya trends, which in Colombia is another mosquito-borne disease, viral in nature, you can see that this is another mosquito-borne threat that has gained a foothold in the country. Again, it rises and falls with the wet and rainy seasons, but they have not had a chance to eradicate this either since 2014 when it gained a foothold in the country. It has a very well established presence like dengue fever, and another indicator that if Zika virus is allowed to establish its presence, they will have a very hard time eradicating it. Okay, so the big thing in the news recently is Zika virus is a relatively minor inconvenience and disease when it affects adults, like dengue and chikungunya, causes fever, rash, joint pain, headache, and very uncomfortable feeling, but it does not cause hemorrhage like dengue fever, does not cause long-lasting arthritis like chikungunya, but has been positively correlated with microcephaly. So what does all of that actually mean? What it means is that they found a rising incidence of infants and stillbirths and miscarriages of pregnant women who have tested positive for Zika virus, and their infants and some placental tissue that have tested positive for Zika virus and have had this condition called microcephaly. So what microcephaly is an abnormal growth of the brain in an infant where the brain is not caught up in size either before birth or after birth. So the head is abnormally small. It is below the growth percentile in what is expected for the age of the infant. And in November 2015, it was discovered the initial condition was made in a deceased infant in Brazil, and then they started noticing more and more cases. At first they thought it was a coincidence, but then they noticed that these were happening in areas where there was a high percentage of Zika virus, and it was outside the normal range of what they were expecting to find in microcephalic children. So where they were expecting to find a certain number of babies that were born with small heads for their gestational age, the age of conception and growth inside the uterus, or after they were born, it was much higher statistically than they were they thought that they would find, and it was in these areas where lots of Zika virus was occurring. So right now, over 4,000 cases are under investigation. There are 270 cases that are confirmed, and in Colombia, there are 900 that they're watching very, very closely of mothers who have tested positive for Zika virus, and they're following them as a study group to make, to find out if there is they can link a causation to Zika virus. Now, there's a big difference between a correlation and a causation. So a correlation is just a linkage between two factors, and that's an important distinction to make. So there are many different things that can cause microcephaly. There are several different viruses that they know of that can cause small brain development in children. There are toxins, there are environmental causes, there's maternal drug use that can cause this. So they can't say that definitively it's Zika virus that causes it. But because there was such a high incidence of Zika virus in relation to this high number of babies that were born with small heads and small brain development, they can't say that it's not Zika virus. And out of an abundance of caution, a lot of agencies like the US CDC and Public Health Canada and the UK and Australia and a lot of countries have come out and just said for women of childbearing age, pregnant women really needed to think twice before they traveled to countries with a Zika virus that was known to be locally transmitted there, so that they wouldn't put themselves at risk for this. And some countries, El Salvador, Jamaica, and Brazil themselves have put out notices that they've said you might want to reconsider conceiving for the next few years until they've discovered more about Zika virus. Now, these are extreme measures. Jamaica does not have a case of locally acquired Zika virus yet, but they still, wanted to discover more about what this virus meant and whether there was a positive link between the virus and these birth defects. So these cautions extend to people planning conception because they just don't know enough about this as to how long this virus might last once you get it, and any kind of genetic abnormalities that it may cause, and how long it may last inside the tissues of people, whether it can be transmitted sexually. Zika virus has been found in urine, and they really need more research into this, and it is such a risk that they don't want people to take these chances until they know more about this. So do dengue and chikungunya carry similar risks as Zika virus? Because they are similar in nature, carried by mosquitoes, and exist in the same areas. These are questions people may be thinking or asking. To date, no health experts have made the relationships between birth defects and dengue virus and chikungunya virus. Even though they're cousins, they have not been found in newborn infants or in the placenta or known to show birth defects. Stillbirths, miscarriage, and anomalies have not been linked to either disease, with the exception of dengue with its relationship to hemorrhagic disease. Future studies may connect birth defects to these diseases, but so far to date, there has not been any positive correlations with anything specific. To that note, women who are pregnant, planning to become pregnant, or who may be pregnant but uncertain, in those first few weeks where, tests may not be positive, should take all protections against insect bite and consult their physicians before any type of travel where any of these diseases may be prevalent. So what can you do about this disease, whether you're of childbearing age or not, or just any type of traveler who may be going to any of these areas? Well, you need to know what some of the signs are and what some of the risks are. So you need to know where these risk areas are, and it seems like every day another area, another country is being added to the Zika watch list. And keeping up with current information is one of your best ways to prevent and mitigate the disease. Knowing what the signs and symptoms are. So if you are in one of these areas and you start feeling poorly, knowing if this is a possibility is another way of doing it. Monitoring yourself for fever or for rash or aches and pains are, knowing how these risks get to these places in the first place. Like I said, with trade, understanding how these things spread. And then most definitely using every bit of bite prevention that you can is your best way of avoiding, any of these diseases. Using DEET, the products containing mosquito repellent is extremely important on any part of exposed skin. They have ruled that 20% DEET is safe during pregnancy, and spraying it on your clothes, coating your clothes with permethrin, which you can find at most department stores and sporting goods stores, coating your hats and your long sleeve clothing, your pants, wearing socks and shoes, and any sort of protection that you can where it's at all feasible in some of these warm weather areas is very important in protecting yourself from mosquito bites. Sleeping in quarters that are air conditioned or have full screens if you must remain outdoors, even though they're day-biting insects. Still you don't want to take the chances. That's not to say that, some of them won't bite at night. So sleep under bed nets and be protected at all times. So again, know your current risk areas. Understand environmental precautions if you're at resorts. Find out if they do external and internal spraying. Look for holes in screens on the windows and make sure that there's no rips or tears so that you're protected. You can duct tape over those if you're living, or repair the screens. Look for standing water on your property and empty any containers that may have standing water. Pots for plants and the dishes underneath there are notorious for collecting water. Flat rooftops may be uneven. Potholes in the roads, make sure that those are filled in, and unlevel sidewalks are the same way. Cracks. It takes very little for mosquitoes to lay eggs and larvae to hatch. So clothing, you can wear lightweight clothing, head coverings, bandanas treated with permethrin are very protective as well, and quite comfortable if you don't have hats to protect you. So corporations and hospitality, you can take measures too to make sure that mosquitoes are away from your sites and protect your employees and guests, and know your duty of care responsibilities. Communication is a good way to let everybody know what to do and to help out. Many hands make light work. Reduce the standing water in and out of establishments to reduce the breeding grounds, making sure that garbage is picked up, because even wrinkled papers or cellophane can collect water when it rains, fills in holes, and reducing uneven areas so that the water is cleaned up and nothing can lay eggs. Again, checking roof areas, cleaning out the gutters, making sure that leaves aren't collecting in areas, because those hold water really well and make for great places for mosquitoes to lay eggs. They make things called mosquito dunks, which are safe for the environment. They're bactericidal or environmentally safe soap that you can put in larger areas of water that you need, like retaining ponds and decorative fountains and things that have very slow-moving water circulation, and they don't harm, birds or any local flora or fauna. There are fish that love to feed on mosquito larvae that are good to have, that are, again, environmentally friendly. Keeping water circulating aggressively in areas too will reduce mosquito larvae and breeding grounds. Adequately chlorinating the water that you can chlorinate also will reduce mosquito breeding, and assuring that all screens are intact and free from holes, rips, or tears, and that there is a weather sealant against doors and windows so that no mosquitoes enter into buildings will also reduce the threat of this disease or other types of mosquito diseases. So I hope that a lot of this information, I know that there was a very quick rundown of this, help to fill in some of the gaps from what you've been hearing in the media. The WHO, the World Health Organization, will be holding a meeting on Monday to discuss Zika virus, its rapid emergence into the Americas and other areas, because the mosquito vector that can carry it is in parts of Europe. It's definitely throughout the Americas and well into the United States. It is not viable in Canada. The climate is not hospitable to these two vectors, but they're still concerned. So they are considering a public health emergency of international concern, which is a measure to free up funding for further research into vaccines and rapid testing. One of the issues is because the presentations are so similar to dengue and chikungunya, and because of the possible correlations with serious diseases and neurological abnormalities as well as birth defects. A lot of people are flooding hospitals, clinics, and laboratories wanting testings, and that's putting excess strain on local healthcare systems throughout the Central and South America, as well as potentially into North America as the spring and summer months come, and there's great potential for Zika virus transmission closer into the United States. We need better testing and more rapid testing to determine, what virus somebody has. There is no cure at this point. There is no vaccine at this point, but funding, is going in that direction to, make vaccines and look for better means to treat this disease and to prevent this disease. One thing about a lot of these areas in the Caribbean and the islands and the United States is that pockets of local transmission are very possible, but like dengue, where we've had local transmission in the Florida Keys and in parts of Texas, it's very easy to stamp out with mosquito spraying and other very aggressive measures, such as genetically modified mosquitoes that have been released, which have been very successful, and other types of programs. So widespread viral transmission, in the U.S. is highly unlikely. There's a very low probability of this becoming problematic. Here, it's in countries that are more resource poor and that do not have good mosquito control problems or programs in place, that are having these types of problems. So with the Summer Olympics coming up, I know that these are great concerns for a lot of people, and plan alterations are taking place. The airlines are being extremely cooperative with a lot of people who have had travel plans. They're working with a lot of people in refunding or rerouting, as our cruise lines. It is causing business impact and economic concern, and this is one area where a lot of people are working together very well, and in a very good way. So we're seeing a huge collaboration and cooperation with the public and private sectors with this disease, and we hope to see that continuation in the ensuing weeks while governments and people get this under control. And we will open up for questions.
Great, thank you. Yeah, that was a lot of information, very informative, and we've gotten some nice comments. A couple of questions have come in. One is that about Mexico. Is Zika in Mexico yet? And if so, in what areas?
Okay, Chris,
Yeah,
do you want to talk for a while?
Yeah, sure. So Zika virus has been reported in Mexico. So far there have been about a dozen cases reported in the states of Chiapas, Jalisco, and Nuevo León. It's likely occurring in other areas, but we have not confirmed that yet.
Okay. Another question says, the iJET bulletins this week have included helpful links to Google Maps for each region. Are these maintained by iJET or CDC, and will they be dynamically updated as new countries are added to the list?
Yes, those are our iJET maps. They are based largely on information from the CDC and from other health authorities, and we do plan on maintaining those, updating them whenever more countries are added or as countries are removed.
And there's a second part to that question. It says, currently absent from the CDC list, but bordering Zika countries are Peru, Costa Rica, Nicaragua, Belize. Is it basically a matter of time before these countries get added?
Unfortunately, I would say yes.
Okay. Does infection with Zika confer lifelong immunity from the virus?
We believe so. It's still a topic under investigation, but we do believe that infection confers lifelong immunity.
Okay. Is Iguazu Falls a risk area? It expands across Argentina and Brazil. Is the Argentinian side safe?
That is another area where it will not surprise us if we see Zika virus activity in that area. That's one part of Argentina that does experience dengue fever activity. It does have the mosquitoes that can transmit Zika virus, so it's probably only a matter of time before disease activity is found in that area.
Okay. Do you have links travelers can use for more info or places they can go if they believe they are affected?
If a traveler, if a traveler thinks that they are affected and they're experiencing any kind of symptoms, they should immediately call their provider. If they're on travel, they should have an assistance provider. Hopefully they have travel health insurance, and then their assistance provider can direct them to the best health provider in the area. Or if they've returned home, then they should see their either follow up with the health provider that they saw before they left for immunizations and a health exam, and if they, unfortunately, if they didn't, then they should follow up with their primary healthcare provider. Let them know of all of the areas that they visited and they might have been at risk for contracting Zika virus, so that they can get the best medical care and treatment.
Do you know if travel to these areas defers the traveler as a blood donor?
Yes, currently that is a kind of a new thing that they've just put out in the past week or so. They are deferring blood donations from people who are potentially at risk for Zika virus until they know more about this.
Okay. Is the mosquito that carries West Nile virus the same as the two that carry Zika?
Generally, no. At least in the United States, the primary vector for West Nile virus is a species called Culex.
So it's a different mosquito. Okay. Do we know how long the Zika virus stays in your system?
Unfortunately, no, not yet.
Yeah, not specifically. That's what they're hoping to free up more funding to be able to do more research into this. Because it was such a little known virus and it really didn't affect that many people, and then when it did, it was, really kind of a mild disease, and nobody gave it a second thought. So, we don't really know that much about dengue and chikungunya either, when in the grand scheme of things, and that affects millions and millions of people worldwide every year. So that's what they're hoping to do with some of these declarations and all of this media coverage and things, is know more about it.
Catherine, there's a couple of questions that are coming in, so about, that they've found it in urine, possibly in semen. So can you kind of talk about the human-to-human transmission potential? Do they know enough?
So we don't, and that's another thing, is that we really just don't know enough about this. So currently it is still classified as a mosquito-borne threat. So we get it from mosquitoes. Mosquitoes bite an infected person, and the mosquitoes carry it, and then they bite an uninfected person, and they give it to that person. And then that person gets bitten by an uninfected mosquito, the mosquito gets it, and that's the cycle. It's one case, right, Chris, of that they're pretty sure of a potential sexual transmission.
Yeah, so this topic is it's based off of a very limited study that identified one presumed case of sexually transmitted Zika virus infection. So there's still a lot of research that needs to be done in order to confirm that that's truly what happened in that case, and to determine how great the risk is for wider human-to-human transmission.
Right. So in this, because it was this one case, again, we've got to talk about correlation and causation. So that's not to say that there wasn't a mosquito in the room at the time. These people were engaged in, sexual activity, and that this other person wasn't bitten and got Zika virus. If it appeared the Zika was viable in the semen, or why it was even tested after the fact, we don't know. So there needs to be more research done. I mean, we know it can be. Go ahead.
I was going to say, what about mothers passing it through breast milk to their infants?
We don't know that either positively. I mean, we know it can be passed from mother to infant. It is in the placenta. It is in utero, but that's a completely different mechanism of transmission.
Mm-hmm. Okay.
So all of this is going into further study and research, and there's a big push to find this all out. It's a very important topic of conversation, research, and study right now. Very high priority.
We're getting a ton of questions. A couple more. You all have a few more minutes?
Sure. Absolutely.
Okay. So since not all cases of Zika present symptoms, do you suggest all travelers returning from these areas to the U.S. get tested to confirm they have not been infected?
Okay, they have come out with an algorithm with Health and Human Services. So to not overwhelm the medical system, like I said, there's no good rapid test like there is for malaria. There are very good rapid tests on the market for malaria. But because this is an emerging virus, because it's a relatively new virus, there aren't good rapid tests. So what happens is if there's a very high index of suspicion that you have Zika virus and your doctor decides to do a test on you, determines that it's important, it gets sent to what's called a reference lab. And then, it's a very expensive process and kind of an overwhelming process to do it. And we can't just do that on every single traveler that has a headache and a rash. and had a little bit of fever. So they've developed, Health and Human Services and the CDC have developed what's called an algorithm. And if you remember back to the 2009 H1N1 pandemic, where they said we can't test everyone that has the flu, that's just going to break the system. So we're going to take the people that are kind of most important to test, and we're going to test them. And they're doing the same thing with this. So if there are people who are pregnant or think that they're pregnant, they're going to go into the hopper first. And they've been to a definite area, these countries determined by the CDC to have local transmission of Zika virus. They've definitely been bitten by mosquitoes. They have, fever, documented fever, rash, headache, and joint pain. Then they are going to get tested. And then the algorithm kind of, goes down from there. So not everybody is going to get tested. Males in their 30s in good health, the Zika virus is going to run its course. And they are at very little risk for, having a poor outcome. And what their doctor will probably do is say, monitor yourself for increasing or escalating symptoms, report to me every day, and then they'll have, kind of like a checklist to go through. And if you are getting worse or you have this, you can't move your toes or you can't move your foot or something, then come back and see me, and then we'll go through this next set of protocol. But, pregnant women will get tested, if they have these symptoms and things, and then there's a second stage and a third stage, and this is kind of what we did with the H1N1 pandemic before they developed the rapid tests. And then hopefully within the next 6 months, we're going to have a rapid diagnostic test, which will make things a whole lot easier for everybody.
Okay, just a couple more questions. Wait, where did that go? Knowing that there's no vaccine for Zika, if one is infected on travel overseas, is there any hope that they will be cured?
Cured is kind of a funny word. There's like no pill that will cure them. No, because it's a virus, it's not an antibiotic. Kind of thing. There's no medication that you can take or anything to cure you. It's going to have to run its course, and then your immune system is going to have to do the job.
Okay. And finally, what should the business sector use as a basic reference to give to employees? For example, the CDC Symptom Diagnosis and Treatment link for Zika, something from iJET. What should they use?
Sure. So there's several resources. The CDC is a great place to start on that. iJET, we have several resources available. We have information sheets that can be reproduced and handed out. We have a video for employees that you can post on your intranet. It's a 1.5-minute long animated video that has information about what to look out for and what measures to take to protect yourself. We certainly can help guide you through employee communication. We had a special report that went out that's also posted up on our company internet, going to ijet.com, it's highlighted up there that you can click on, and is very informative. Again, I would wait until the WHO meets and publishes something a little later on Monday, because what comes out of that meeting will be instrumental in what decisions are going to be made going forward, and there may be some changes to the guidance that the CDC comes out with based on that. And then certainly we will be making some of our posture decisions based on what the WHO suggests in helping companies going forward.
Okay, and of course this recording will also be up on iJET.com.
Mm-hmm.
So, and if there's further questions that we didn't get to, you can always email those to health@ijet.com, and they will be routed to the correct person that would be able to answer your questions. I want to thank Catherine and Chris for this webinar. It was very well attended, well received, well presented, so thank you all for your time and your questions.
Great. Thank you very much.